this has more mutations than any other variant that's been seen, and a number of the mutations are in the spike protein, so that's what really is raising people's anxiety level. Whether it's the mRNA vaccines or the J&J vaccine or some of the protein vaccines that may come down later, they're all focused on targeting and developing an immune response to the spike protein. And spike is what attaches to the cells too, so that probably, well, definitely relates to transmissibility. So mutations in the spike can increase transmissibility and also potentially increase the ability for the virus to avoid antibodies made by the vaccine. We have no clear idea whether the vaccines will be equally effective or not, but I think the argument would be that we know that there's a potential that it might not be, and that the higher your antibody concentrations are, the more likely it is to be able to work. And so if you haven't gotten a booster, you need to get boosted. So the clinical presentation is going to be the same, right? COVID-19 is COVID-19, and so it's going to present identically. I think we just all are trying to make our way through the days. I mean, this is now going almost on 2 years of COVID, and so I don't think you're going to feel much different. We still have a significant amount of transmission that's occurring in Sacramento due to the Delta variant, so I'm not necessarily expecting anything to change significantly. We'll just have to see. I think people should be thoughtful, but not necessarily concerned, right? I think that people should be watchful about what's happening. I think you're still looking at making sure that you've got a booster dose of vaccine, or if you haven't been vaccinated, get vaccinated, and then consider minimizing exposures to big, large groups, unless it's outdoors. So the most important thing about Omicron is that it continues to be the evolution of COVID-19. The more people that get infected, the more likely we are to see more variants come back behind it. And so, again, this is a message to get people vaccinated, right? This is right now, the unvaccinated population is really keeping the whole pandemic moving along. You're not going to see the number of breakthrough cases if people are all vaccinated, right? Because that's the way you finally crush this. And we're just not really at a level within our population. We're pretty darn good here at UC Davis, but within the population at large, we're not at a level where we can really stop spread. And every time the virus infects somebody else, there's a chance for more mutations. And if those mutations are beneficial to the virus, they're going to keep taking off. And so the more people infected, the more likely there are going to be, we're going to have to learn the whole darn Greek alphabet. The public should know that staying vigilant is a good thing, and getting vaccinated if you're not is a good thing. That's ultimately the way out of this thing.